This video is designed to help you decide whether Beaumont's weight control program is right for you. Embarking on a weight loss program is a journey, and this seminar will introduce the steps you will be taking with our Beaumont team. Starting with guidance from a physician to structured diet and exercise plans, we will work with you to help you achieve your weight loss goals. Once you've watched the video, please fill out the online form to begin the registration process.
When it comes to managing weight, many people feel alone, seeing a long, winding road full of pit stops and setbacks. But you don't have to go on this journey by yourself. At the Beaumont Weight Control Center, we'll be your partner. We'll help you make the right choices to lose a significant amount of weight and keep it off.
Congratulations on taking this first step towards finding a long-term, comprehensive solution to managing your weight and your health. Obesity is a major health problem in the U.S., and it is considered an epidemic.
Obesity is the leading cause of preventable death in the United States. The majority of adults in the U.S., about 68%, are overweight or obese. The cause of obesity involves many different factors. The current widespread obesity problem is believed to be largely due to changes in our environment and lifestyles, with inappropriately large portion sizes of foods and drinks, processed foods that are high in fat or sugar, as well as relatively sedentary lifestyles. Most of us do not have physical activity built into our daily lives, which was common in years past. Instead, a lot of us spend hours each day sitting in front of computers, TVs, and other devices.
In addition to the change in our environment and lifestyles, there are other factors that promote weight gain, such as genetics, medical conditions, stress, certain medications, and poor sleep can also promote weight gain. Having an unhealthy weight can lead to other problems. It raises risk for diabetes, high blood pressure, heart disease, and stroke. Excess weight is also associated with high cholesterol, sleep apnea, fatty liver, joint and back pain, and even some cancers. The good news is that many weight-related medical problems can improve or even resolve with weight loss. A lot of people are able to decrease or even discontinue medications as they lose weight. Additionally, most people do report that their overall quality of life is much improved after weight loss. Developing healthier lifestyle habits and losing weight can prolong your life.
At the Beaumont Weight Control Center, you become more than a part of a medical weight loss program. You enlist an entire team of medical professionals to help you lose weight and keep it off. A Beaumont physician, nurse practitioner, or physician assistant will complete a medical evaluation before you get started. At that appointment, we'll review your medical history, test your blood, and check your heart rhythm with an EKG test. This will help us set up a safe and individualized treatment plan for you. The next step is appropriately called an instructions class. At this session, a psychologist, exercise specialist, and dietitian review your weight loss plan in detail with you and get you prepared for your journey to better health. With your plan in hand, you'll begin with a Lifestyle Foundations group, which meets once a week for 16 weeks. Following Lifestyle Foundations, you'll move on to further group support or complementary maintenance groups once you are at your goal weight. We'll talk more about the support team a little later, but first, let's talk about how we arrive at your individual goals. Creating your goals takes a team, with you as the most important player. When you join Beaumont's program, we look at 3 different measurements to calculate your health: body mass index, waist size, and a body composition scan. Body mass index, or BMI, is your weight divided by the square of your height. An elevated BMI is associated with increased risk of developing chronic diseases like diabetes, high blood pressure, and sleep apnea, as we talked about earlier. A BMI between 18.5 and 24.9 is considered normal. Between 25 and 29.9 is considered overweight, and a BMI of 30 or greater is considered obesity. The size of your waist is another important measure. As waist size increases, disease risk also increases. In general, the ideal waist size for a man is less than 40 inches, while for a woman, it is less than 35 inches. An increased waist size can lead to metabolic syndrome, insulin resistance, diabetes, high cholesterol, and high blood pressure. These conditions ultimately lead to heart disease and stroke. The third measurement is a body composition scan. A scan tells us your body is made out of 2 things: fat tissue and lean tissue. We can then express the amount of fat as a percentage of total body weight. There are two things we can do with this information: identify your desirable weight and monitor changes in lean and fat tissue throughout your program. For some people, the best road to weight loss is bariatric surgery. A candidate for surgery has a BMI of 40 or greater, or a BMI of 35 or greater with other medical conditions. You can learn more about bariatric surgery by attending a free seminar about this option. Visit beaumont.org/bariatric to register for an in-person seminar or view the online version. Just remember, surgery is only one component to achieving a healthy you. Diet, exercise, and lifestyle change will also be key.
The most successful weight loss program is combined therapy that focuses on nutrition, physical activity, and lifestyle change, rather than focusing on just one of these components alone. This is what we do at the Beaumont Weight Control Center. Established in 1983, we have a multidisciplinary approach that encourages a healthy diet, physical activity, and lifestyle changes. We focus on the person's overall health to determine his or her best weight loss plan. Our team not only supports you, we also educate and medically monitor your progress every step of the way. There are several Beaumont Weight Control Centers across the area.
To stay on the path to a healthier you, we can't stress enough the importance of physical activity. Being physically active helps people live longer and have lower risk for heart disease, stroke, type 2 diabetes, depression, and some cancers. It also helps with weight control and can improve academic achievement in students. 5 to 7 hours of exercise a week is a characteristic of people successful at maintaining weight loss. An alternative to structured exercise is to simply increase your physical activity throughout the day. We encourage using pedometers or activity trackers. A few years ago, we did a study and learned that people entering our program typically accumulate 3,000 to 5,000 steps a day. We're shooting for 12,000 steps a day. That's a characteristic of people maintaining a desirable BMI. While working on developing an exercise routine, our program will help you tackle your eating habits. This change in lifestyle is essential to long-term weight loss success. Lost weight will be regained if old habits come back.
What you eat is so important. You'll be working with a medical provider and dietitian to devise a meal plan that helps you to meet your goals. Our program includes meal replacements, such as shakes and protein bars, as an effective tool for weight loss. Clinical research has shown that meal replacements are more effective than all food diets. They're easy to use and work by reducing calories, while still meeting daily nutrition requirements. They also stabilize blood sugars and insulin levels. We break down meal plans into two phases: weight reduction and weight maintenance. Let's start with weight reduction. At your first appointment with a medical provider, you'll determine which of these 4 options will work best for you each day: full meal replacement with vegetables, 4 meal replacements and 1 meal, 3 meal replacements and 2 meals, or an all-food plan with the option of using 1 or 2 meal replacements. Once you have reached your goal, the second phase is maintenance. It is an all-food diet with or without 1 or 2 meal replacements. During both phases, we have cooking demonstrations for easy and delicious recipe ideas. Side effects are possible while on meal plans, but rare. They include frequent urination and constipation. There could be abnormal lab results and fluctuation of liver enzymes. Rapid weight loss is also associated with gallstone formation.
Now you know about your individual goals and what steps you'll be taking to reach them through diet and exercise. Let's talk about your support team. For 16 weeks, you'll meet with your clinical team and a group of people just like you. Research shows that regular attendance at group sessions will result in better weight loss outcomes. The sessions combine psychology, nutrition, and exercise education and support. There are 8 psychology-focused sessions, 8 nutrition-focused sessions, and 4 exercise sessions, co-led by a psychologist or dietitian. After you're done with all sessions, and if you're ready, we'll move you into a free long-term maintenance program. The maintenance program involves ongoing weekly sessions and 2 individual sessions per month with a dietitian or exercise specialist. If you're not ready for maintenance, you will continue with ongoing weekly group sessions. While not mandatory, we do strongly encourage group attendance. During this entire program, you'll be medically monitored and have individual sessions with our medical team. You also have the opportunity to talk with a licensed psychologist or counselor at the very beginning and throughout the program. These sessions are billed to your insurance. It's optional, but strongly recommended to help you achieve your goals.
Unfortunately, not everyone is a good candidate for our program. This includes people actively abusing alcohol and drugs, those currently undergoing treatment for cancer, and people with symptoms of potentially serious medical conditions that have not yet been explored. In fact, some conditions may require we consult with your doctors before starting. For some people, a more conservative diet may be needed, like someone with type 1 diabetes, or those with significant medical problems, such as chronic kidney disease or congestive heart failure. Others may be interested in our nutritional health program. This is for patients interested in improving their overall health through nutrition and lifestyle. It includes a follow-up with medical providers. In this program, we identify vitamin and nutritional deficiencies. We also offer advanced testing including a body composition scan, bone density scan, resting metabolic rate testing, and micronutrient vitamin testing.
By following the Beaumont Weight Control Program, the roads you choose will lead you to life-changing results. Successful patients know that they are a member of the team. By keeping regular attendance, they lose an average of 50 pounds and keep the weight off for 4 years or more. We found in one of our clinical research studies that type 2 diabetes resolves with an average weight loss of about 50 pounds. Other benefits include improving weight-related medical conditions. You can reduce your risk for developing medical conditions in the future, increasing energy and endurance, and overall just a better quality of life.
Many services in our weight control program are often covered by insurance. This includes a new patient medical evaluation, EKG, blood tests, ongoing medical visits, and individual psychology sessions. Before starting the program, please verify with your insurance company what would be covered. Services not covered by insurance include instructions classes, lifestyle foundations groups, cooking demonstrations, individual sessions, and meal replacement products. You should know we can tailor the program to fit your budget.
To get started on this road to weight loss, call any of our Beaumont Weight Control Centers. Select the location most convenient for you. Our staff will be happy to help you schedule your first appointment. There are a few things we would like you to bring to your first visit, as you would to any other doctor visit. This includes current medication bottles, a list of drug and food allergies, the name of your primary care physician, a copy of a referral authorization if you do have an HMO, and your insurance card. If you had an EKG or blood test within the past 3 months, please bring copies of these as well.
Your journey to weight control is ready to begin, and we'll be there for you every step of the way. The Beaumont Weight Control Program, here for you today and all along your path to a healthier tomorrow. Contact us today at beaumont.org/weight.